Hi, I'm Carla Gullotta. I'm a fifth-year oncology resident currently working at the Hospital Clínico Barcelona. And today I'm going to talk about the 3 studies presented at the Congress which bring new important insights in early HER2 positive breast cancer. The first update comes from an exploratory analysis of the international phase 3 ALTO trial, which originally evaluated whether adding lapatinib to trastuzumab in the adjuvant setting could improve the disease-free survival and the overall survival. The aim of this exploratory analysis was to assess which adjuvant endocrine therapy is the most effective in the subgroup of patients with hormone receptor positive, HER2 positive breast cancer. From the original cohort of more than 8,000 of patients, 2,651 patients were included. 57% of patients received a SERM, mostly tamoxifen, and 43% of patients received aromatase inhibitors. After 10 years of follow-up, a clear benefit in disease-free survival, time to distant recurrence, was seen in the aromatase inhibitors group across all the subgroups, regardless the tumor size, the nodal involvement, the age, the type of treatment, and the menopausal status. In premenopausal women, the treatment with aromatase inhibitors plus ovarian suppression was the more efficacious in this subgroup of patients. But no significant overall survival benefit was seen in this analysis. So, in conclusion, aromatase inhibitors may be the most appropriate endocrine adjuvant treatment in this subgroup of patients. The secondary analysis of the COMPASS HER2 PCR trial, which evaluated the escalating neoadjuvant treatment with the paclitaxel, pertuzumab, and trastuzumab for 12 cycles, followed by 2 antibody in the patient who achieved a PCR. The aim of this secondary analysis was to explore the correlation between the TILs in the basal biopsies and the likelihood of achieving PCR. More than 1,300 biopsies were analyzed, and the key findings were that higher TILs were correlated with the higher PCR rates in both hormone receptor positive and hormone receptor negative HER2 positive early breast cancer. When TILs was analyzed as a categorical variable, the greater benefit was seen just in hormone receptor positive breast cancer. Adding in the multivariate analysis the HER2-DX testing, this association was lost. So, in conclusion, TILs show a correlation just in the univariate analysis, but adding the HER2-DX testing, this association was lost. So, maybe it could be better to use a multi-omic analysis to predict the PCR. The third update comes from the translational analysis of the ctDNA of the Fergain studies that evaluated the escalating neoadjuvant treatment using the PET-TC scan after 3 cycles to use a chemotherapy-free regimen. In this exploratory analysis, the aim was to assess the correlation between the detection of the ctDNA and the PCR, and also the clearance of ctDNA and other patient outcomes like, of course, PCR and invasive disease-free survival. The blood sample were collected at the baseline after 2 cycles and before the surgery. And the key findings of this secondary analysis were that the ctDNA detection was found in 70% of patients, and the detection was correlated with the tumor stage. 33% was detected in the stage 1, 73% in stage 2, and 93% in stage 3. The detection of ctDNA was not correlated with PCR. The clearance of ctDNA was detected in 73% of patients after 2 cycles and 83% before the surgery. And the clearance of ctDNA was strongly correlated with the PCR. The clearance of ctDNA and also the absence of the detection of the ctDNA baseline were correlated with a better 3 years invasive disease-free survival. So in conclusion, the primary objective of this exploratory analysis was not met, but ctDNA could be a useful biomarker to explore the invasive disease-free survival and confirm also the importance of the minimal residual disease after a neoadjuvant chemotherapy. Thank you.